For all men who are in their 50s and who don't believe that there could be a change happening in the urinary system, must listen to this short talk. It is important for us to realize that when we touch 50, there's a complete paradigm shift of a lot of changes happening internally in the body, which happens in the brain and the heart and the liver and the lungs, in the kidneys, organs which function in your favor. An organ which undergoes a change is the prostate, which in the years when men gracefully age and come into the limelight in 50s, the prostate undergoes a change where the prostate undergoes a growth that is visible to you, discernible by the ultrasound report given to you in your annual health checkup. The health checkup only shows that a prostate has undergone a change, the change that you perhaps are not aware of before. So to know, a prostate, a male gland below the urinary bladder, where it controls the exit of the urinary flow by trying to gradually compress the urinary system, and therefore the flow gradually goes down in our fathers and grandfathers' age, actually starts very early in life. Somewhere late 40s, early 50s, there's a change happening in the urinary system, but the prostate, because of hormone-related changes, is going to grow. And that grow is something which you see on the ultrasound and get anxious about in your health checkup starting 50s every year. The prostate could be 25 grams, 30 grams, 50 grams, and the growth is a lot of it innate internally that you and I can't stop it. So a urologist at that age group in your 50s is very keen to see you if you have urinary complaints or you do a health checkup. For example, at the Kokilaben Hospital, when we see men in their 50s, we ask them questions on their urinary issues, on their sexual issues, on aspects which are changing. And many a times people may not be aware that a progression of change is happening. For example, many men may not be sexually active around at that time, or many men could be active and could be demanding for more and capable activity in the bed for which we give them medications. Similarly, men come and complain of urinary issues in 50s, and one needs to know what are the complaints that men could have at the age of 50s. Number one, because of the compression of the urinary passage as a result of the growth of the prostate that you see, men can complain of taking time to start urine. So when you go to a public toilet and want to pass urine, you still take a longer time to pass urine compared to what you used to take or others take. That means you take a longer time to empty your bladder. You take a longer time to start urination. Therefore, we call it as hesitancy, a prolonged time to complete urination, which you think has completed. But then when you come out of the toilet, you think the bladder is not emptied completely, which is incomplete voiding or incomplete evacuation. So on the one side, you're not emptying your bladder fully. Other side, you take a longer time to empty your bladder. You take a long time to start urination. And when you look at the stream, the same stream is very thin and narrow. These are all related to the obstruction to the flow of urine. A poor stream, taking longer time to start, longer time to finish urine, you still don't empty your bladder completely, and you dribble a little longer thereafter. The sonography shows your bladder wall is getting thickened because they are pushing the urine out, and the bladder therefore is overworking in the background of a changing prostate scenario where a young man's prostate of 10 to 15, 20 grams has changed to 25 grams, 30 grams, 50 grams. So a wake-up call for all men in 50 is that if you have got urinary complaints, number one, of the time when you take a longer time to empty and don't empty completely on one side, and on the other side, you've got issues where you have got increased frequency of urination. You get up multiple times at night. You probably are not able to empty your urine completely. There's a burning sensation. Sometimes you see that there is a little bit of frequency in the day and night, and you have to rush to the washroom before you would leak urine. All the complaints which actually do start have got a genesis in the issue of bladder and prostate understanding. The bladder contracts, the prostate opens up, and urine comes out. It was so simple and easy, and we could paint on the walls when we used to pass urine with a good speed, all the way far away with a good trajectory and a good kind of a speed. You remember those days. But as time goes by, there are changes which happen. And therefore, a wake-up call to all men in their 50s. Because that's a time you can bring about a reversal. You really can't change your age from 50s to 40s anymore. But a lot of reversals can be brought with medical management. And therefore, a urologist in your city, in your location, is your friend. At the Kokilaben Hospital and Department of Urology, we continue to see men who come after a health checkup and they're worried about their prostate size growing up. Their PSA is a marker which we look at and get to know more about a change happening internally, which again is a marker. Many a times only an organ-specific marker or a surrogate marker. It does not always signifies a disease. So therefore, a doctor or a urologist is actually concerned about looking at your complaints, your performance in a urinary toilet, which is called a uroflowmeter, doing a uroflowmetry, and looking at the larger picture of a composite urinary health and a male health. Therefore, men's health is an important topic. Today, when we look at men in the 50s, under stress of maintaining their lifestyle, looking at the crisis of mid-age in terms of balancing a lot of things at work at home, they also go through trouble which sometimes is very unforeseen and sadly never discussed. So men's health rotates around diabetes control, which could be going wrong, about their cholesterol controls around, about their cardiac issues, which could change their blood pressure controls. While all this is happening on one side, physical gradual changes in quality of life happens, which means the erectile dysfunction and sexual function creeps in. The men feel more incapable, morally less in their confidence level. On the other side, you look at them gradually changing and looking at the urinary flow system, which happens to their parents, their fathers, and their grandfathers. So, wake up call for all men, because today a urologist is equipped with those instruments, those evaluations, those investigations, and those kind of treatments, provided you and I talk across the table. So, meet your urologist in your city, in your hospitals, in your locations, and talk over regarding your urinary health and your sexual health. It helps your urologist understand how you are, your frequency of episodes of activity in the bed, how much you are capable about, how good is the early morning erections, and don't forget your antihypertensive medications, your diabetes status, all have an effect on the men's health and your sexual activity. All have an effect on your changes in your early morning erections. All have your effect on your morale and confidence. On the other side, hormone changes also bring about an internal intraprostatic change, where the prostate undergoing a growth can bring about an occlusion to the urinary passage. So if you are in your 50s, I'm going to touch 60s in 10 years' time or earlier or later. It is important for us to wake up that if we have urinary complaints, we just don't do investigations. We also see an interpretation of the investigations done by a specialist across the table who helps you out to take it forward to the final level, where he would look at reversing changes. He would look at improving you and getting you better. And therefore, let's not hesitate. It's time to take health to the front row seat, and men's health should come to the front row seat only. Good luck.